Chapter 15. Critical Thinking in Nursing Practice. Clinical judgment is an essential skill that involves the interpretation of a patient's needs, concerns, or health problems, and the decision to take action or not, to use or modify standard approaches, or to improvise new approaches on the basis of a patient's response. Nurses apply knowledge, clinical experiences, and professional standards when thinking critically and making decisions about patient care. As nurses develop professionally, it is important to acquire critical thinking skills that allow you to face each new patient care experience or problem with open-mindedness, creativity, confidence, and continual inquiry. Critical thinking is acquired through experience, commitment, and active curiosity. Critical thinking is not a simple step-by-step linear process that is learned in a short period of time. Clinical decision-making separates a registered nurse from technicians or care associates. Technical personnel are directed by nurses to perform certain aspects of care and report back any important observations to keep informed. Thus, the registered nurse is responsible for making accurate, appropriate decisions on the basis of clinical information. The registered nurse relies on knowledge and experience when deciding if a patient is having complications that call for notification of a healthcare provider, or if a teaching plan for a patient is ineffective and needs revision. When a clinical situation develops, the registered nurse must learn to recognize it, interpret the meaning, and respond appropriately. Each patient's health problems are unique, a product of the patient's physical health, lifestyle, culture, relationship with family and friends, living environment, and experiences. With experience, you learn to creatively seek new knowledge, act quickly when events change, and make quality decisions for patients' well-being. You will find nursing to be rewarding and fulfilling through the clinical judgments you make. Critical thinking defined. Critical thinking is the ability to think in a systematic and logical manner, with openness to question and reflect on the reasoning process. A critical thinker considers what is important in each clinical situation, imagines and explores alternatives, considers ethical principles, and makes informed decisions about the care of patients. Critical thinking is a way of thinking about a situation that always asks, why? What am I missing? What do I really know about this patient's situation? And what are my options? The use of evidence-based knowledge, or knowledge based on research or clinical expertise, makes you an informed critical thinker. Critical thinking requires cognitive skills and the habit of asking questions, staying well informed, being honest and facing personal biases, and always being willing to reconsider and think clearly about issues. Nurses who apply critical thinking in their work focus on options for solving problems and making decisions, rather than rapidly and carelessly forming quick, simple solutions. Critical thinking is more than just problem solving. It is a continuous attempt to improve how to apply yourself when faced with problems in patient care. Please review Table 15-1, Critical Thinking and Clinical Judgment Skills, and Table 15-2, Concepts for a Critical Thinker, as a supplement to this PowerPoint. Reflection and the ability to act on the basis of critical thinking comes with experience. When you care for patients, begin by thinking about previous situations and considering relevant issues. For example, what did I notice before? How did I act? What could I have done differently? What should I do next time in the same situation? Research shows that when nurses reflect on past experiences, they perceive that their knowledge increases and their critical thinking moves to a higher level. Reflection involves playing back a situation in your mind and taking time to honestly review everything you remember about it. Reflective reasoning improves the accuracy of making diagnostic conclusions. By reviewing your previous actions, You see successes and opportunities for improvement. Always be cautious in using reflection. Reliance on it can block thinking and not allow you to look at newer evidence or subtle aspects of situations that you have not encountered. Please review Box 15.1, Tips on Using Reflection, as a supplement to this PowerPoint. Case Study. Carla is a third-year nursing student assigned to a surgical nursing unit. Mr. Javier Ramirez is a 55-year-old construction worker, admitted after falling off scaffolding on a construction site. His X-ray films reveal a right femur fracture and right wrist fracture. An abdominal computed tomography scan shows bruising of the liver. Mr. Ramirez has not been hospitalized in the past. When he first meets Carla, he is very quiet and asks few questions. Do you think that because Mr. Ramirez is very quiet and asks few questions, he will be easy for Carla to care for? Critical thinking in nursing. At the basic level of critical thinking, a learner trusts that experts have the right answers for every problem. Thinking is concrete and based on a set of rules or principles. A basic critical thinker learns to accept the diverse opinions and values of experts, such as nursing instructors and nurse preceptors. However, inexperience, weak competences, and inflexible attitudes can restrict a person's ability to move to the next level of critical thinking. Complex critical thinkers begin to separate themselves from experts, and analyze the clinical situation and examine choices more independently. In complex critical thinking, each solution has benefits and risks that you weigh before making a final decision. In complex critical thinking, each solution has benefits and risks that you weigh before making a final decision. There are options. Thinking becomes more creative and innovative. The complex critical thinker is willing to consider different options from routine procedures when complex situations develop. You learn to gather additional information and take a variety of different approaches for the same therapy. At the commitment level, nurses anticipate when to make choices without assistance from others and accept accountability for decisions made. As a nurse, you do more than just consider the complex alternatives that a problem poses. The nurse chooses an action or belief that is based on the available alternatives and support it. Because they take accountability for the decision, nurses consider the results of the decision and determine whether it was appropriate. Shown as Figure 15-1, Critical Thinking Model for Nursing Judgment. Case study continued. Mr. Ramirez's leg is in skeletal traction and his right arm is in a soft cast. Carla decides that she needs to begin her care by assessing Mr. Ramirez and determining his health status. She begins by reviewing his medical history. She learns that he has a history of smoking, and was diagnosed with type 2 diabetes just 5 years ago. Do you think Carla is making the right decision to begin her care of Mr. Ramirez by assessing his health status? Critical thinking competencies. The scientific method is a systematic, ordered approach to gathering data and solving problems and has 5 steps. Identify the problem, collect data, formulate a question or hypothesis, test the question or hypothesis, and evaluate results of the test or study. Effective problem solving involves evaluating a situation over time, identifying possible solutions, and trying a solution over time to make sure that it is effective. It becomes necessary to try different options if a problem recurs. Decision-making is a product of critical thinking that focuses on problem resolution. Following a set of criteria helps to make a thorough and thoughtful decision. The criteria may be personal, based on an organizational policy, or, in the case of nursing, a professional standard. The person has to weigh each option against a set of personal criteria, test possible options, Consider the consequences of the decision, and make a final decision. Decision-making involves moving back and forth when considering all criteria. It leads to informed conclusions that are supported by evidence and reason. Diagnostic reasoning is the analytical process for determining a patient's health problems. Accurate recognition of a patient's problems is necessary before you decide on solutions and implement action. It requires you to assign meaning to the behaviors and physical signs and symptoms presented by a patient. An expert nurse sees the context of a patient's situation, observes patterns and themes, and makes decisions quickly. Part of diagnostic reasoning is clinical inference, the process of drawing conclusions from related pieces of evidence and previous experience with the evidence. When making an inference, you form patterns of information from data before making a diagnosis. When uncertain of a diagnosis, continue data collection. You have to critically analyze changing clinical situations until you are able to determine a patient's unique situation. Clinical decision-making involves making a decision that identifies the problem, reducing the severity of the problem or resolving the problem completely. Skilled clinical decision-making occurs through in-depth knowledge of a patient's patterns of responses within a clinical situation and knowing the patient as a person. It has two components: a nurse's understanding of a specific patient and his or her subsequent selection of interventions. To foster knowing your patients, do the following. 1. Spend more time during initial patient assessments to observe patient behavior and measure physical findings as a way to improve knowledge of your patients. Determine what is important to them and make an emotional connection. Patients perceive meaningful time as that involving personal rather than task-oriented conversation. 2. When talking with patients, listen to their accounts of their experiences with illness, watch them, and come to understand how they typically respond. 3. Consistently check on patients to assess and monitor problems to help you identify how clinical changes develop over time. And 4. Ask to have the same patient assigned to you over consecutive days. Researchers have noted that a nurse-patient relationship develops from getting to know a patient. It helps build a foundation for connecting on the first day of care, to deepening understanding of the patient and sustaining a connection by the second day, and to being comfortable with the patient by the third day. Social conversation and continuity are important for developing the nurse-patient relationship. Nurses should always keep the patient as the center of focus while trying to solve the clinical problems. When you work in a busy setting, use criteria that include the clinical condition of the patient. To manage the wide variety of problems associated with groups of patients, skillful, prioritized clinical decision-making is critical. The purpose of the nursing process is to diagnose and treat human responses to actual or potential health problems. Use of this process enables nurses to help patients meet agreed-on outcomes for better health, shown as Figure 15.2. 5-step nursing process model. Please review Box 15-3, Clinical Decision-Making for Groups of Patients, as a supplement to this PowerPoint. A critical thinking model for clinical decision-making. The ability to think critically, improve clinical practice, and decrease errors in clinical judgments are aims of nursing practice. Learning to apply each element of this model and the way you think about patients will help you become a more confident and effective professional. Knowledge prepares you to better anticipate and identify patients' problems by understanding their origin and nature. As a nurse, your knowledge base includes information and theory from the basic sciences, humanities, behavioral sciences, and nursing. Nurses use their knowledge base in a different way than other healthcare disciplines, because they think holistically about patient problems. The depth and extent of knowledge influence your ability to think critically about nursing problems. Clinical learning experiences are necessary to acquire clinical decision-making skills. Knowledge combined with clinical expertise from experience defines critical thinking. With experience, you begin to understand clinical situations, anticipate and recognize cues of patients' health patterns, and interpret the cues as relevant or irrelevant. The nursing process competency is the third component of the critical thinking model. In your practice, you will apply critical thinking components during each step of the nursing process. 11 attitudes define the central features of a critical thinker and how a successful critical thinker approaches a problem. 1. Confidence, belief in oneself. 2. Thinking independently, considering other ideas and concepts before forming an opinion. 3. Fairness, justly dealing with the situation. 4. Responsibility and accountability, knowledge that you are accountable for your decisions. 5. Risk-taking, unconventional actions taken in an effort to solve problems. 6. Discipline, missing few details, is orderly or systematic when collecting information. 7. Perseverance, determination to find effective solutions. 8. Creativity, finding solutions outside the standard routines of care while following standards of practice. 9. Curiosity, asking why and what if. 10. Integrity, questioning and testing one's own knowledge and beliefs. And 11. Humility, admitting limitations in knowledge and skill. Professional standards for critical thinking refer to ethical criteria for nursing judgments, evidence-based criteria used for evaluation, and criteria for professional responsibility. Excellent nursing practice is a reflection of ethical standards. Nurses routinely use evidence-based criteria to assess patients' conditions and determine the efficacy of nursing interventions. Please review Box 15-4, Components of Critical Thinking in Nursing, and Table 15-3. Critical Thinking Attitudes and Applications in Nursing Practice, as a supplement to this PowerPoint. Case study continued. Carla knows that Mr. Ramirez is likely to be in pain because he is reluctant to move and take part in any activity. Her options include conducting a thorough pain assessment and learning how Mr. Ramirez feels about his pain. She must also be culturally sensitive and consider how Mr. Ramirez's Hispanic heritage may influence his response to pain. Carla will then take what she learns and use pain control therapies Mr. Ramirez will be likely to accept. Do you think Carla is following the nursing process? Case study continued. When Carla notices that Mr. Ramirez is slow to respond to her questions, grimaces when shifting weight on his back, and is reluctant to have a bed bath, her critical thinking leads to the inference that Mr. Ramirez is in pain. Carla decides to assess the situation more thoroughly by asking Mr. Ramirez specific questions about his comfort, such as, "Tell me if you are hurting, show me where the pain is located, and is this pain you have felt before?" Before Carla begins her questions, she repositions Mr. Ramirez to make him more comfortable. As she does so, she observes an area of redness over his left heel. Redness could be due to inflammation or pressure on the skin. Carla palpates the area, noting that it is tender to touch and warm. She asks Mr. Ramirez if he has been moving his leg much, and he says, "No, I haven't. I am afraid I will hurt my other leg." These initial findings imply that excess pressure is being applied to the heel. Since we know that every patient a nurse cares for will not have the exact same health status, the nurse should be prepared to meet the challenge of each patient's individual needs. Time for a quick quiz. The use of diagnostic reasoning involves a rigorous approach to clinical practice and demonstrates that critical thinking cannot be done A. logically, B. haphazardly, C. independently, or D. systematically? The answer is B. haphazardly. Critical thinking should be done using a systematic approach, using knowledge and experience to formulate an opinion. Case study continued. Carla gently applies pressure to the area with her finger and notes that after pressure is released, the area does not blanch or turn white, a key sign of excess pressure. She thinks about what she knows about normal skin integrity, the effect of immobility, and the effects of pressure on the skin. The information she collects leads her to determine that Mr. Ramirez has an early-stage pressure ulcer. The nursing diagnosis would be impaired skin integrity. How would you rate Carla as to her competencies at each step of the nursing process? Carla continues to gently encourage Mr. Ramirez to describe any symptoms or sensations that he is experiencing. He tells Carla that he does have pain in his stomach. Carla asks him to place his hand over the area of discomfort. Mr. Ramirez places his hand over the lower right quadrant of his abdomen. On a scale of 0 to 10, Mr. Ramirez rates his pain at 7. Carla inspects the area more closely and palpates gently over the abdomen for the presence of tenderness. She notes that the abdomen feels very tight. Do you think Carla anticipated this latest information from Mr. Ramirez? How important do you think it is for a nurse to be adaptable? Critical thinking synthesis. Critical thinking is the reasoning process by which you reflect on and analyze your thoughts, action, and knowledge. As a beginning nurse, it is important to learn the steps of the nursing process and incorporate the elements of critical thinking. Critical thinking and the nursing process go hand in hand in making quality decisions about patient care, shown as Figure 15-3. Synthesis of critical thinking with a nursing process competency. Developing critical thinking skills. Reflective journal writing is a tool for developing critical thought and reflection by clarifying concepts. These concepts are embedded in the day-to-day clinical situations and problems you face. Tips for exploring clinical experience include: which experience, situation, or information in your clinical experience is confusing, difficult, or interesting? What is the meaning of the experience? What feelings did you have? What feelings did your patient or family have? What influenced the experience? Do the feelings, guesses, or questions remind you of any experiences from the past or something that you think is a desirable future experience? How does it relate? What are the connections between what is being described and what you have learned about nursing science and theory? Nurses depend on others to help them think like nurses. The way to develop critical thinking skills is to meet regularly with colleagues, such as faculty members or preceptors, to discuss and examine work experiences and validate decisions. Connecting with others will help you learn that you do not need to know everything because support is available from other colleagues. Concept mapping is a nonlinear picture of a patient to be used for comprehensive care planning. The primary purpose of concept mapping is to better synthesize relevant data about a patient, including assessment data, nursing diagnosis, health needs, nursing interventions, and evaluation measures. Mapping organizes or connects information in a unique way so the diverse information that you have about a patient begins to form meaningful patterns and concepts. Managing stress. The work of a professional nurse is difficult as you see patients endure suffering from disease and painful therapies, and as you try to manage care responsibilities in a busy, fast-paced work setting. The connection between stress in a healthcare setting and its effects on a nurse's mental and physiological state is receiving more attention, autonomic control of decision-making, error detection, speech, memory, and emotions during stressful situations are disrupted because of continued sympathetic nervous system stimulation. Stress over a prolonged period, or when extreme, can lead to poor work productivity, impaired decision-making and communication, and reduced ability to cope with clinical situations. For example, research shows that the stress of working 12-hour shifts impairs medical judgment, in part because of the way stress affects attention. Please review Box 15-5, Evidence-Based Practice, Impact of Stressful Work Environments on Thinking and Decision-Making, as a supplement to this PowerPoint. Time for a quick quiz. The nursing process organizes your approach while delivering nursing care. To provide the best professional care to patients, nurses need to incorporate the nursing process and A. Decision-making, B. Problem-solving, C. Intellectual standards, or D. Critical thinking skills. The answer is D. Critical thinking skills. The nursing process and critical thinking go hand in hand in providing patient-centered care. The nursing process cannot be completed without critical thinking informing nursing diagnosis, setting goals, interventions, and evaluation. Case study continued. Carla does what she can to position Mr. Ramirez more comfortably and makes sure his leg discomfort is under control. She knows that the increased pain and tightness he is experiencing suggest that something is causing pressure in the abdomen. It could mean the patient is having bleeding from his bruised liver. Carla decides to call Mr. Ramirez's physician immediately. Do you think Carla made the right decision?